Hey everyone, and welcome back. Today I'm going to be sharing another VA medical benefit that you may be eligible for. Now, I know with the VA and medical benefits particularly, it can get very confusing very fast. So today we're going to be talking about the Patient-Centered Community Care Program, and this is a program where the VA will pay for you to have treatment from a civilian provider. So let me first explain how the system works, how it can benefit you, and then some considerations for using the program. Now, the first thing I want to do is kind of get you to think back to when you were in the military. When you were in the military, your first line of care, the first person, the medical professional that was going to treat you was your PA. Now, the PA was typically at the battalion level, aid station, or something like that. If you're sick, if you have any kind of issues, you go to the PA and they give you the care you need. This is the equivalent of your VA primary care manager. So the VA, once you get out, once you enroll in the VA system, they have very small clinics in most of the major cities. Even a lot of the smaller cities have them. Now, you go to this primary care manager if you need a flu shot, if you need some lab work, if you need basic medical care, right? They're equivalent with your PA, basically. Now, if your PA, let's say you were in the military, your PA couldn't treat you for something. You needed an x-ray, you needed some advanced work done. They would send you to a military hospital, right? If you're on a larger base, they have the military hospital. If not, they'll send you to another base that does. Now, this is equivalent of the VA hospital. Now, in very, very rare circumstances, when you're in the military treatment center is not going to have the care you need. Perhaps you need a specialist or you have something weird going on that they don't know what it is, and they will refer you to a civilian provider. Now, here's the thing. When you're in the military, if they send you to a civilian provider, if they authorize it, it is going to be covered. When I was in the military, they referred me off for a pretty major surgery, and I didn't pay a single penny of this because I had that authorization, I had the referral. Now, if the VA cannot provide the treatment that you need, now, this could be they don't have the equipment, they don't have the specialist, but it could also be that it's too far away, right? So maybe the VA does offer a service, but it's only offered at a VA center 200 miles away. Or perhaps it's going to be a 6-month wait for them to see you. If you can't get the care you need through the VA, they will authorize you to go to a civilian provider. Now, there's a couple different programs they have for this. They have the Patient-Centered Community Care Program and the Veterans Choice Program. To be honest, I'm not an expert in either of them. I don't really know how they're different, but I will share experiences with the Patient-Centered Community Care. The first thing that you need to know about this program is it can take a while to be seen. So this is not something you want to use for an urgent condition or something where you need to be seen right away. So for example, I went to see my primary care manager, my VA doctor, about the middle of February. And she put in the referral and said, okay, we're going to send you up to the VA hospital. So I'm going from the PA to the hospital, right? And the hospital said, hey, we don't have the specific kind of equipment we need to look at your condition. So the VA hospital then referred me to the Patient-Centered Community Care Program. Now, Patient-Centered Community Care is managed by Tri-West, I believe. So about the first week of March, I got a text message on my phone from Tri-West. You click on this link and it takes you to the Tri-West website. It has you validate your information, and then Tri-West actually schedules your appointment for you. So it'll ask you questions like, do you prefer morning or afternoon? Do you prefer this provider or that provider? And the cool thing about this is Tri-West has a database of all these providers that are registered through the Patient-Centered Community Care Program. So they've had to meet certain standards, but they also know what kind of equipment they have, what kind of care they offer. So Tri-West matched me up with a provider that I was supposed to see. Now, here's where things start to get a little bit tricky. You have the VA. The VA is a big system. There's a lot of moving pieces. Tri-West is a big system with a lot of moving pieces. So it can take a very long time for these two systems to talk to each other. And then you also have at this end, you have the civilian provider. So you have three systems that are all trying to talk. So I made my initial appointment about the beginning of March. I still hadn't heard anything after a week. So I called them, I called Tri-West and said, you know, I've made my appointment, but I've not heard anything. And, you know, they said, okay, just keep waiting. Well, at the end of the second week, so this is 2 weeks, I still haven't heard anything. So I had to follow up again and say, hey, it's been 2 weeks, what's the status? And the important thing here is just remember, just stay on top of it. It's going to take a long time because there's a lot involved. You don't want to miss a referral. You don't want to fall through the cracks. So if you're using this program, definitely stay on top of it. Make sure TriWest sends you to a provider. Now, about the 1st of April, I actually got a letter from TriWest, and it's an authorization letter. It's going to say, okay, here's the services that you were authorized. So this is the most important part of this whole process, is checking your authorization letter. So remember, when you're in the military, if you get sent off base to a civilian provider, you know exactly what you're going for. The provider knows what you're going to get done, and TRICARE is going to pay for that. Now, with TriWest and the patient-centered community care program, it's a little bit different because your authorization letter will say specific treatments that you're authorized for. It's not like you go there and you can get whatever treated you want. It's only what is authorized. So when you're looking at your letter, it's going to have specific codes. So it will say you're authorized for a consult, which is medical code 0036 or whatever. And then it'll say you're eligible for outpatient procedures number 0052 through 0059 or something like that. You can look up these medical codes to see what they're specifically authorizing, but the best way to do it is to actually call the civilian provider and say, okay, this is my authorization letter. Is the procedure going to be covered? Now this is important because some things will be covered through this and some will not. So when I went for my initial consult with the civilian provider, that was covered. Okay? So my initial consult was covered. Exact same authorization letter. I went back for the actual treatment, and this is where it gets really confusing because the VA, TriWest, said that my treatment would be authorized, right? So it was, for them, it was considered necessary treatment. But the civilian provider considered this to be elective treatment or cosmetic treatment, stuff that wasn't medically necessary. So the exact same condition, but depending on how TriWest and the VA classified it versus how the civilian provider classified it, it was not covered. Now, thankfully, for me, the procedure wasn't super expensive, so I was able to pay out of pocket. But if you have some kind of major condition, something going on, that could be a big hit on your finances, just coming back and all of a sudden having to pay for this yourself. So take care of yourself before you do this. Get your authorization letter, take it to your civilian provider, usually their front desk staff, see what procedure they're going to do to you, and make sure ahead of time, specifically ask them, is this procedure going to be covered? Because you don't want to find yourself owing them hundreds or perhaps even thousands of dollars. So, patient-centered community care program, like I said, I'm not an expert, just giving you my experiences. Like I said, pros of the program, it can help you pay for some of this. Some of it will cover, some of it will not. Disadvantages, it's going to take a long time to get this, so don't try and use this for any kind of urgent care, something that you need right away. If any of you guys have experiences with this, if you've used it, or if you know a little bit about it more than me, leave a comment. We're all trying to help each other out here navigating the VA system, so leave a comment, help your fellow veterans out. If there's anything else you guys want to know, if you have any questions, just leave a comment. I'll try to do my best to answer them. Hope you all found the video useful, and I'll see you next time.